Do you get a sharp stabbing pain in your buttock when you first stand up, where it feels like your hip locks up and you have to just stay there for a minute before you can even possibly think about straightening up and taking a step? If so, this video is for you. I'll explain why that happens, how to stop it, plus exercises you can do to prevent it from happening in the future. So first of all, what causes that sharp stabbing pain in your buttock when you stand up? There are several things that can cause it, but if it's just on one side and only happens with transitional movements, such as standing up from sitting or rolling over in bed or sitting up from bed, one really common reason is a hypermobile or excessively mobile SI joint or sacroiliac joint. Hypermobile joints have more than the normal amount of motion, and they're subject to locking up, particularly when they've been in an end range position for a prolonged period of time. Your sacroiliac joints are the joints between your spine and your pelvis. And when you bend forwards like this, or bring your hip up like this, it rotates one side of the pelvis backwards. When you're forward bending or sitting where both legs are in a relative position of flexion, both ilia rotate backwards like that. Now, that's not a problem under normal circumstances, but if one side of your sacroiliac joint is hypermobile or excessively mobile, it's likely to get stuck there, and when you go to stand back up, those ilia have to rotate back forwards. But if that can't happen, you get that sharp stabbing pain, and it feels like you just have to stand there. You can't possibly take a step. So how do you stop that from happening? Well, one really easy way to do that is to think about the things that stabilize your SI joints. And two of the primary stabilizers of your SI joints are your deep abdominal muscles as well as your glutes or buttock muscles. So when you first go to stand up, your hips are in a relative position of flexion. So as you go to stand up, you want to lean forwards like this, pop your buttock up. Then think about tightening or tensing your abdominal muscles, squeezing your glutes, and then using your bottom muscles to kind of push your hips forwards. That helps stabilize your SI joints and makes it a little bit easier for you to stand up. To see that from a side view, what you'll do is lean forwards like that. So you're taking your hips into a relative position of flexion, popping your bottom up so they're still in flexion, and then instead of trying to stand straight up like that, you're tightening your abdominal muscles, squeezing your glute muscles, and using those to push yourself up into a standing position. Come about 75% of the way up, and then take a step with the non-painful leg first, and then proceed to stand up and walk. And that'll help you to stop your SI joints from locking up when you first go to stand up. Now, what do you do to keep that from happening in the future? Well, in the acute case where you've got a lock, one joint is stuck backwards, there's an easy thing that you can do at home to get it unlocked. And that is, if this is the side that's rotated relatively backwards like this, it's stuck in a position like that, you're actually going to lie on the side of a bed or a couch in this case, and take the other hip into that motion. So this one's stuck up in that position. You're going to take the other one up into that position, pull it all the way to your chest as far as you can, and then let this one drop off the side of the bed. Then you're going to squeeze the glute on this side and try to pull it down a little bit farther, but you don't want to allow your lower back to arch. So make sure you're really keeping this hip pulled up toward your chest. That'll keep this side of the pelvis pulled backwards and allow you to stretch the other side down forwards. Now, if you have someone that can help you at home, there's another thing that you can do where you can have someone put pressure down here, just very gentle pressure down there while you push up against their pressure, and hold that for about 5 seconds. Then relax and have them stretch your leg down just a little bit farther. Then you'll push up again, hold for about 5 seconds, and then relax and they'll push your leg down a little farther. Repeat that 3 to 5 times, but remember to keep this leg pulled up toward your chest so your lower back's not arching as you're doing the motion. After doing that several times, stand back up and see how you feel, and often that can give you some instant relief from the pain. But how do you stop it from happening in the future? Well, again, you need to think about the things that stabilize the SI joints and help keep it from getting into those end range lock positions. And largely that's the glutes. So one great way to strengthen your glutes from a lying down position is lying like this, doing a pelvic tilt back that way. That flattens your spine out. Then think about activating your glutes. Push your knees out to the side like that, and then do just a very slight lift of your buttock up off the bed or couch or floor, wherever you happen to be doing it. You don't need and probably shouldn't do an excessively high lift like that. It's just a slight pelvic tilt. Squeeze the glutes, push the knees slightly out to the side, very slight lift. Hold about 5 to 10 seconds, and then come back down, reset, and repeat. Pelvic tilt, tighten the glutes, knees out to the side, very slight lift, hold 5 to 10 seconds, and repeat that 10 times. So that was one way that you can strengthen your glutes to help stabilize your SI joints. If you'd like more ways to strengthen your glutes, check out this video over here. But before you go, if you found this one helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.